Welcome back to this special episode of Immune Confident YouTube channel. Today, I am joined by a dear friend and colleague for a really important purpose and mission. So Dr. Ashley Chambers is a double board certified physician in internal medicine and lifestyle medicine, and she has a clinical focus on proactive prevention, longevity, and menopause care. After over a decade of practicing traditional primary care, she is now building a proactive, prevention-focused practice that empowers patients to take charge of their health through evidence-based strategies in movement, nutrition, and hormone optimization. She also writes The Proactive Path, a newsletter exploring the intersection of lifestyle medicine and longevity science. And we will make sure that all the links to her fun, amazing resources are in our show notes. But first of all, thank you so much for joining me today, Ashley, and really hoping to have a really poignant conversation. And we're reconnecting for a pretty special reason. So maybe I'll let you kind of share a bit about why specifically we're chatting today.
Yes. And thanks so much, Kaia, for having me, and what a important reason to come together. And I'm so glad to be here to share today a little bit about my experience being a bone marrow donor. It took place in med school, so a few years ago now, more than a few.
Couple.
I know. Feels like yesterday in a lot of ways. But yes, I really appreciate you reaching out to me to kind of share, what that experience has been like, and to help our dear colleague's daughter, hopefully.
Yeah. So for those who don't also follow on social media or subscribe to my weekly RX email, our dear colleagues, their daughter Kaia was diagnosed with aplastic anemia, which means her bone marrow has essentially stopped making the white blood cells, the red blood cells, and platelets that your body needs to be able to fight off infection, to carry oxygen around in your body, and to kind of stop up the gaps if you have a bruise or a cut. And so the thing that is really challenging for beautiful Kaia is, in part of the bone marrow match process, typically that match is someone who looks genetically similar to you. And she has this beautiful mixed heritage of Korean and Indian American background. And so that just makes finding a perfect match for her a little more challenging. And so what we're hoping today is I'm going to ask Ashley some questions about her experiences, because I know a lot of my patients and followers have asked some questions about like what's all involved, and like I'm a little scared about the process. And so I'm curious to learn. Usually there's a bit of a gap sometimes between when you are screened and when you're matched. So I would love to hear a little bit about when you decided to get screened and what that process was like.
Yeah. So I was in my first year of med school, and Red Cross came to our med school, to the building, and did a blood drive. So I participated in a blood drive, and after you donated, they were like, "Here, let me swab your cheek. You can be part of this registry." So it was kind of like, hey, I'm here, I'm helping. Like, I would love to be part of this registry. And honestly, I mean, I probably, like most people, you don't really think it's going to ever become anything. But fast forward 2 years later. So yes, a big gap, 2 years. I was in my third year of med school. And I remember getting a phone call after phone call. So they do not give up, right? If you don't answer the first time, they call you again and again. And her name was Jan, and she worked for, the Be the Match, and was like, "Hey, we need you," and kind of explained the whole process, and then kind of went down the road. So, and it was kind of a no-brainer at that point, right? When, they call, you're like, yes, I will 100% do anything to help. And I was in med school in Dayton at the time, and this was all done at OSU. So it was kind of over months of preparation, lots of testing. I probably went to Ohio State maybe twice, I think, if I recall, for like an EKG and labs. But just a lot of, and the organization was fantastic, like so much good communication. And I was in med school, so I knew a little bit, but honestly, I didn't know a lot, right? You're kind of like still clueless for a while in med school, I feel like. So I was coming at it from a standpoint of like, not like a full practicing physician, right? I still have a lot to learn. So, and they explain it very well and help you feel very well prepared.
So it sounds like from the screening process, It was as simple as just a little, almost a fancy Q-tip inside your mouth. And that was it. And then from kind of that follow-up testing after they determined you were the match, EKG, maybe some blood work, I'm guessing.
Yes, EKG and blood work. I think I had to repeat it again from my recollection. There was like a delay in the donation and the collection. So I think, it was drawn out another 6 months. So it's a bit of a process, and you're kind of at the whim of like what's happening on the other end. But very good communication and yeah, pretty. I mean, a blood draw, EKG, and a cheek swab, but nothing painful, uncomfortable, all, and very well explained.
Yeah. And so just to like put EKG stickers on the chest, and then they essentially get a heart tracing, and that's about it. So pretty.
Yep. A little snapshot of your heart.
Low lift. Now,
100%.
How about for the actual donation? There's often some misconceptions about what bone marrow donation entails, because it sounds pretty invasive when you think like bone marrow that's inside your bones. Like, are they going to have to do a big surgery?
Yeah. And luckily, no big surgery, nothing particularly painful about any of it. What they do is they stimulate your bone marrow for about 5 days leading up to the collection. And what they're doing is they're kind of hyping up your stem cells in your bone marrow, right? They want you to make a whole lot extra so they can take all the good ones out and then give them to the recipient. So they used a medicine called filgrastim for me. I think it's still a pretty similar process now. And they actually arranged it. So they had a home healthcare nurse come to, I was staying at my now husband's apartment in Columbus for the time being. And they came to me, the home health nurse, and gave me the injection. I think it was a sub-Q or an IM, but just did it all for me. I didn't have to do anything. And that was like daily for 5 days leading up to the donation, something around that timeline. But, and so that was easy, right? They came to me, that was, pretty straightforward. And then you go in and spend a day at, it was called the apheresis unit. I was at Ohio State, and they collect the stem cells there. And that is, they just hook up a line and collect them that way. So there is no big procedure or injection per se. You're just kind of resting in a chair for about 8 hours, and yeah, pretty painless.
So kind of like an IV placement, it sounds like, but a little fancier maybe.
Yeah, a little fancier IV, something that can kind of stay in safely throughout the day. And you're monitored, and you have kind of all the snacks and things you want, and you kind of watch movies and go about your way.
Do you recall any kind of side effects or issue, like recovery kind of things, like how long it took for you to feel back to normal afterwards?
Yeah.
We're a busy time.
Yeah. Leading up to it, the injection they stimulate your bone marrow with made you a little like sore, like achy a little bit. But honestly, it was nothing that like held me down per se. I remember like still exercising, and I went back to rotations the next day. So, and that kind of side effect of the achy joints faded about after a day. So you're kind of back at it the next day. So it's really just the day of the collection that you're kind of have to be there doing it. But otherwise, it's kind of business as usual.
And any long-term effects or complications that you've dealt with?
None at all. And, there's been a lot of studies looking at donor safety, and it's all been like really great and reassuring. No long-term effects or risks from, the medicine or the collection.
Yeah. And so I think, just to kind of reiterate, that medicine is helpful to kind of boost up. So you have extra cells that, can be donated, but you still have the ability to make those cells ongoing. They're not taking them all from you. It's not leaving you immune compromised or anemic or anything along those lines.
Correct. Yeah. None of that. Yeah. You're just kind of boosting up, making extra, and then they take that and leave you with yours. So, awesome. And they did great follow-up. They called me a whole bunch, lots of exit interviews and things and checkups at 6 months, a year. So I can't say enough about the organization.
Looking back, what do you think was the most rewarding aspect of your donation experience?
Yeah, I mean, it was really an incredible experience. I think kind of twofold. It was interesting as a medical student and someone in healthcare to kind of be in the place, a little bit of a patient, like in that setting.
Absolutely.
And that was powerful, right? Having kind of a different view of things as I was in my training. And then I mean, the other piece is just really feeling this connection to someone you don't know and probably will never know, but and knowing you can give that gift. It's been profound.
Yeah.
So it's a beautiful experience.
So if anyone is interested in seeing if they are a match, either for Kaia or for someone else that truly needs this life-saving gift, one way that you can connect is as easy as texting Team Kaia, TEAMKAIA, to 61474, and that will send you the link so that you can get registered. They'll send you that swab. You can do it from the comfort of your home. It's already addressed and has the postage. So you just put it back in the mail. And then answer your phone. If you are the match, answer the phone and say yes. I think this is really hopefully the purpose of, if one additional person hears your story, Ashley, and says yes, gosh, how incredible to see that gift. Just keep on giving. And sorry, I'm getting emotional just thinking about all of it. And so we will follow up and let folks know what we find out. And we would love to hear your comments below if you have been a donor, if you've been a recipient, and anyone who can share this. There is a timeliness to this, right? So patients like Kaia become dependent on transfusions, and transfusions work for a while until they don't. And these folks are opened up for, increased risk of infection. So time is of the essence. So go text Team Kaia to 61474. And then when you get that call, please, please, please come back and listen to this and then say yes. Any parting words? Dr. G.
Thank you so much for having me and for what a great cause. So yes, get out there and text the number. It's easy, it's simple, and you can save a life and change a life and change a family's life. So please do.
Thanks so much. And keep
Thank you.
updated.